Hi everyone, my name is Gabrielle and I would like to introduce our group members. We have Bruce, Caitlin, and Jonathan. The at-risk population that we chose was women with substance abuse. We chose this because during our practicum, we were able to see firsthand how addiction affects women. Not only their health, but there's a lot of social issues that they face with an addiction or substance problem. Social problems that women with addiction face, one is public perception. Women feel ashamed when entering addiction programs. They feel that they are looked down on and that they are unworthy of getting help or treatment. They feel that there's a big difference in how they look at a man and how they look at a woman. The next is women wait longer to get treatment due to the role of being the caregiver. They have children that need to be taken care of. If they leave, who's going to take care of their children? They worry about custody issues. If they leave them with a family member, will that family member maybe turn them in? Will the family member decide that they don't want to keep them and try to give them to someone else? They worry about if they're divorced, their spouse stepping in and taking their children and losing custody. And worst, they worry that the state will step in and pull their parental rights from them. Whether it be temporary or permanent, they worry that they will lose their children. The next one is barriers that they face when attempting to get help. Addicts feel that they are a part of a special group, their social group, and they have their own social standing within these groups. They don't feel that they need help. And there's no one within their group or their circle that's going to give them the encouragement and the support that they need to go get help. So therefore, it takes them longer to admit that they have a problem, and then it takes them longer to step out and say, "Hey, I'm going to go get help." Next, we have the gaps that we aren't really sure about when it comes to women in addiction. We are unsure what women with addiction actually face due to the different struggles that they have within their lives. Again, children working, losing a place to live, losing custody of their children. Those are all things that we really don't know what women face in their daily struggles. We're unsure of the addiction differences between men and women. During our research, we found that scientific statistics say that women progress faster in their addiction, such as like maybe alcohol. Women have less of stomach enzymes that break down alcohol, and that makes them more vulnerable to becoming addicted. They also have more fatty tissue, allowing the alcohol to absorb quicker into their bloodstream, which also creates an impact on drinking, how much they have to have compared to how much a man has to have. The physical impact on women having one drink equals to a man having 2 drinks, making the brain and other organs exposed to higher levels of alcohol for longer periods of time, which creates medical issues quicker for women. Another gap women face is in this population is the stigma of how the world will perceive a mother that is an addict, leaving her to feel very hesitant about getting help because they may lose their children if there is no one that could be there to care for them. Again, women, a barrier for women, a big barrier we found out is women who have children. They don't know which way to turn. Also, the results for intervention for women of addiction. During our research, we also discovered that the two types of intervention are medical and mental, depending on the substance being used and the medical diagnosis that will determine what type of intervention that they will need. Most of the time, not only will an addict need medical help, but mental assistance will be needed to assist them with their recovery. The results from the intervention varies depending on factors that directly or indirectly may affect the addict. Some factors can be related to connection with counselors, group sessions, support systems, personal backgrounds, maybe abuse or psychological disorders. There's many things that can cause an addict problems in their recovery. Statistics have shown that when it comes to a drug relapse, between 50 and 90% of women relapse within the first 90 days. When it's alcohol addiction, it says that 45 to 50% of women may return to drinking back to the amount they recovered from within a year. Ultimately, we came to the conclusion that as a group, we were able to build our knowledge on what is unique to women with substance abuse issues. Thank you.